One. Hello, there we go. Good afternoon, everyone. If I could get everybody maybe to make their way over to this side of the room, that would be great. Looking at some of our guest speakers, if you want to make your way over this way a little bit. And we'll get things started. So I do want to say a very warm welcome, and I do want to thank everyone for coming out this afternoon. I know that this will be a very welcome announcement for the future and the stability of our island healthcare system. My name is Zach Bell. I'm the MLA for Charlottetown-Winslow, and I'll be the Master's Ceremonies for this afternoon. We are pleased today to be joined by the Premier of our province, the Honorable Dennis King, as well as the Health and Wellness Minister, the Honorable Ernie Hudson. I'd also like to recognize and welcome some of the representatives of the island's healthcare unions who've joined us for this announcement. Always try to make sure I don't leave anyone off that list, but if I do apologize. I see Barb Brookins, the president of the PEI Nurses Union, joined by Vice President Joanne Chisholm. Welcome. Maybe we'll give a warm welcome. I see Jason Woodbury. I saw him earlier. I think he's in the back there. Perfect. He's the president of the CUPE Local 3324 Paramedics Union of PEI, joined with Vice President Myron Burt, so welcome as well. And I had the pleasure of saying hello to Karen Jackson earlier, the president of Union Public Sector Employees. Welcome, Karen. Give her a warm welcome. And I believe he joined us as well. Thank you very much. The CEO of Health PEI, Dr. Michael Gardam. Thank you for being here as well. And most importantly, I see a lot of staff from the Queen Elizabeth Hospital here this afternoon. We do thank you very much, and we're very sorry to be intruding on your space and your workspace, but again, this is going to be a great announcement, we believe, this afternoon. So we do want to thank you and the frontline healthcare workers from all across our beautiful province for the hard work and the dedication that you put in every single day. So just to let everyone know, and of course those that are joining us online, that following the remarks by the premiers and the union leaders, that they will be available for interviews if needed or if wanted by our media. So it is now my pleasure to introduce the Premier of our province, the Honorable Dennis King, to make today's announcement. Thank you, Premier.
Thank you very much, Zach, and hello, everyone. It's great to be here with everybody today, and it's especially nice to be amongst so many staff members here, so thank you very much for making the time, and good afternoon, bonjour, quoi. It's a great pleasure to be here today to share some of the news with healthcare workers who I think it's fair to say after the last 3.5 years are really the driving force and the backbone behind the healthcare system in Prince Edward Island, and the ones who deliver that service each and every day to islanders from tip to tip. So on behalf of Minister Hudson and all of the government officials here, to all of you who are here and all of your cohorts around Prince Edward Island, thank you very much. You truly are amazing, so thank you. I want to say welcome to Minister Hudson, Zach, thank you very much, Barb Brookins, Karen Jackson, Jason Woodbury, all of the staff that are here. While today's announcement is about healthcare workers and the people that you serve and work with and work for every day, I would be remiss if I didn't recognize that these three individuals in particular and all of their staffs have been playing a big role in what we have gotten to here today, to get some of this stuff over the finish line in support of their respective members, and it's been a challenge. But to all of you, you are, if you don't know it already, you're very, very well represented by these three individuals in particular. They're passionate about healthcare. They're passionate about the people who are working within it, and they've been a great force for positivity and good for me. So thank you very much for that. I would say to all three individuals that I guess I know there are many issues facing us in healthcare, not just in Prince Edward Island, but around the country and across the world. I'm committed to working with you. Ernie and I and so many others are committed to working with you to find some of the solutions to those challenges we face. I've tried very hard in 3.5 years to be a good listener, to learn. Barb in particular has beaten a lot of things into my head, and they've taken, they've stuck. But no, quite honestly, I've really tried in this job. I'm a prisoner to hope. I believe we have the foundation of something really, really solid that we can build and improve upon. I know we can get there. So just on a personal note to the three of you, although we have some difficult conversations from time to time, your leadership and confidence is part of the reason why I have the confidence to make these announcements that we're beginning with today. So again, thanks for that. And just by way of recap, just a few weeks ago, we brought together in the cabinet room the leaders of all of the different stakeholders in the healthcare system. Probably 30 or 35 people or close to it were in the room. Organizations, union representatives, groups, and were represented at that meeting. And the whole point of the meeting was just to say, we know all of the challenges individually and across the board. This is the team of people that we have to address them. How can we best work together to begin to make some of those difficult changes and find some of the challenges? And it was a very productive meeting. One with many positive initiatives that have been started and we've been working on collectively. But I left that meeting with one real beginning, I guess, block, and that is the foundation. And that's what we're trying to do here. Before we can begin to change a system, we have to solidify and stabilize the one that we have. And that begins with the workers in the system every day who are doing the job. And I know in my time in government, we spend a lot of time talking about incentives to recruit people to come here. And I've listened to Barb, and I've listened to Jason, and I've listened to Karen say, that's important, we have to do that. But we have to focus a little bit more on retention and making sure those who are working in the system, keeping the system viable, aren't forgotten, and show that there's an appreciation for that. And that stuck with me, and that's what I guess I say it. If you're building a house, you don't start on the 4th floor. You got to build the foundation, and that's what this is about today. So I'm pleased to announce that there's 3 new programs today that focus on the retention of our existing workforce. Our government is launching over $8 million in retention incentives that include, first, our retention incentive program that provides healthcare providers who currently work in the system with a financial incentive to continue to provide high-quality healthcare to islanders. These incentives include $3,500 for registered nurses and nurse practitioners, $3,000 for licensed practical nurses and paramedics, $2,500 for residential care workers, home support workers, and patient care workers. These incentives are in exchange for a 1-year return in service agreement and will be prorated with part-time employees. We anticipate that this incentive will be accessed by up to 2,400 employees throughout the system, and hours will be backdated to September 2020. Next, we are launching a retirement retention program, which will provide a $5,000 incentive, an incentive program for those who retain those who are eligible to retire in exchange for a 1-year return in service agreement with the healthcare system. In addition to that, we're launching a priority vacancy program. And I will say that this is something that Barb has been, from the first day she took over the job, has said we need to be looking at, which is to provide an incentive of $3,000 aimed to fill the key vacant positions throughout the system. This incentive will be eligible to be stacked with the other incentives that we announced in our program. And with this program, we are hoping to fill 190 vacant positions through the system that have been vacant for more than 180 days. So this is one that I think has been long needed and one we're happy to make. Overall, this investment of over $8,000 is our first of many announcements that we will be making in the days ahead to stabilize our workforce in healthcare in this province. We recognize that these incentive programs are a start. I think they're a good start. Perfection is not the bar that we're trying to achieve here. There will be opportunities to take a look at maybe individual groups or organizations we may have missed. Anytime you unveil a program, there's always talk about why can't it be this or more, or how can we tweak it, and we'd be very open to doing that because we want to make sure those who are working in healthcare feel appreciated and feel remunerated to the point where they can remain an active member in the healthcare system. As I say, I want to reassure everyone that our focus continues to be on recruitment and retention of our workers. The training of our healthcare professionals is first and foremost what we need to ensure that our workforce has the full complement of positions needed to provide healthcare for Prince Edward Islanders. We've all heard the talk about the need for change, how our system is under duress and needs to be tweaked. And the whole purpose of bringing together all of this group was to kind of use the hockey analogy from my sporting background is we can talk about all the recruitment we want, about all the potential draft picks we might have, but the team we have to put on the ice or the floor today are the people who are in this room and so many others. How can we work with them to best position them, to give them the best chance to broaden the scope of their practice if need be, to get others in to help what they do, all with the goal of providing the best possible service for the Islanders that we're here to serve. I say proudly to anyone who will listen, when Islanders really need health care, it's there for them and it's as good as anywhere in the world. But we have made it way too hard to get into the healthcare system in PEI, and we've taken for granted for too long the people who are providing that service. So today is a good first step. It's only the first step, but we're beginning that process to rebuild the foundation upon which we can build the changes that we know we need to make to deliver health care for Islanders. So with that, I say thank you very much, and I'll turn it over to you, Mr. Minister. You coming next? Yeah. Anyway, yeah, thank you very much.
Thank you very much, Premier King. And yes, of course, it is a big part, of course, recruitment, but the retention is, and we hear it as MLAs ourselves about, wanting to make sure that that team that you talked about is happy and providing the best care for all Islanders. So to follow up on Premier King's words, I'm now going to invite the Honourable Ernie Hudson, the Minister of Health and Wellness, to speak on this announcement. Minister Hudson.
Well, thank you very much, Zach. And Premier, it's a great day here. Appreciate the announcement that you just made. Certainly it's something that government, the Premier's office, through Health and Wellness, through Health PEI, have been working on for some time. But without the support, without the input from our union leaders, it would be, I would have to say, that was the most and continues to be the most important group that we have, speaking on behalf of ones like we have here today, our frontline healthcare providers here at the Queen Elizabeth, but also speaking on behalf of our frontline healthcare providers right across the island from tip to tip. As I mentioned, I particularly want to thank the members of PEI's healthcare unions for being here today. Barbara, Joanne, Karen, Jason, Myron, certainly appreciate, it's great to see all of you here today. The leadership of our health unions are irreplaceable partners in our department's efforts to ensure a safe, stable, and sustainable workforce in Prince Edward Island and in the Prince Edward Island healthcare system. There is never any doubt in my mind that our healthcare unions want to do right, that they do right by their members, and that they want to stabilize. They want to strengthen and advance healthcare in Prince Edward Island. And to all three of the union leaders that are here today, I know that in the past we've had some great conversations, maybe not sometimes difficult conversations, I would have to say. But with that, I would like to think that all three of you always feel comfortable in reaching out, and that with that reach out, that if I can't immediately take that call, it's a fairly rapid response to you. So do appreciate that and appreciate the partnership. When you think about it, this program that the Premier just announced, it does make sense. If we are going to invest in strengthening health care, the logical place to start is with people who have already demonstrated their interest and their commitment to helping islanders in need of care. We can be grateful and are grateful to the nurses, to the LPNs, the paramedics, RCWs, nurse practitioners, and all of the others who have chosen to build their careers on PEI and deliver health care to islanders. But saying thank you and expressing our appreciation is only part of what needs to be done. To really make our health facilities the workplaces that they should be, we have to address the concerns of our workers. We have to make it possible to have healthcare professionals working together to their full scope of practice in a collaborative, team-based environment. That is how we can build towards better health outcomes, improved access to services, improved use of resources, and certainly improved use of human resources, and greater satisfaction for both patients and providers. Today's announcement is but one step towards addressing those issues by fostering stability in and encouraging healthcare professionals to remain in PEI's healthcare system. We do truly appreciate each and every one of you who offer care to islanders. You are vital to our health system. And we will continue to look for innovative programs that do address our staffing needs as we work collaboratively to expand and improve our provincial health system. We need to ensure that qualified people will choose to deliver health care here in PEI, and that you are well supported to do so, well supported as valued partners in our health workforce. And as the Premier had mentioned and Zach had alluded to as well, certainly you look at the number of programs that we have with regard to recruitment, they are quite massive, to be honest. But every bit as important as the recruitment end of it is the retention end. And I do feel quite strongly that this is a great step in the right direction with regard to retention and retention initiatives. So with that, thank each and every one of you for coming out today.
Thank you, Minister Hudson, and I think you said it correctly. It's one thing to say thanks, and it's another thing to show thanks, and hopefully this first step is a great way of showing thanks to our island healthcare professionals. Both the Minister and the Premier talked about the importance of having the union voices around that table, and at this time we do want to hear from those union leaders, so we're first going to call on the President of the PEI Nurses Union. Please welcome Barb Brookins.
Thank you, everyone, for being here. Thank you, Premier King, for listening. Thank you, Minister Hudson. We also have people behind the scenes, Pam, Adam, Ryan, wherever you are. I think you're hiding here somewhere. We've been working at this, and since I've arrived in my position as president with the PEI Nurses Union, we've been actively having discussions with the Department of Health and the Premier. Minister Hudson's very open. We've been really trying to put the focus back into retention. There's been a lot of talk about recruitment, but not a whole lot about retention, and nobody with that portfolio sitting open on their desk and actively looking at it. And that's what we're hearing from our members, is that they don't feel that they're being valued, or they hadn't feel they were being valued. New recruits come in and they're offered incentives. but our members are not getting anything. So this is where we were trying to put our focus. And although I didn't get everything I asked for, I got some, and we're still working on some of them, and there's hopefully going to be some more announcements this week. But this has been going on for months, but since August, we've been actively looking at this workforce stabilization plan, and it made sense, and members have been asking for something to recognize the value that they have within Health PEI and the organization and the delivery of health for all of Islanders. So to hear that they've actually finally placed a bit of a dollar figure on it, that's good. We have a lot of nurses who have been looking at retiring at the end of this year. We have nurses that have left the system and are working either in the private sector or elsewhere in the province. So to get them to return, this is also a way of us trying to have the ability to offer them something to come back into the health system. So there's a lot of work. This is just a very small piece of it, a very small step. There's a big intermediate and long-term plan. Dr. Gardam's working on that. But we really needed something in the immediate and now. So hopefully this will at least let people know that your leaders are working, they're listening, there has been a change in tone in the environment, and people are recognizing both provincially and federally that this needs to be addressed. We can't just wait until the broken systems are fixed. We need to look at it in a whole and recognize the people that are holding the system together. The only concerns we did have is that the details obviously are never always included in these plans. So over the next few weeks, we're going to be looking at all the different scenarios that will fall out as a result of these announcements and trying to finalize with human resources, the Ryan Whites of the world, and trying to make sure that all the questions that people are going to throw at us after this are answered. So just hang in there, bear with us. This is kind of the start and the stepping point. What else do I have here? Like I said, lots of work, one step. Anyway, I just want to thank everyone. Like, this is the first time that our healthcare workers have really been recognized at this level. So try to look at it as a positive thing, and this is just one stepping stone to making things better for our members and all healthcare workers that are, like I said, caring for our Islanders. So thank you very much.
Thank you, Barb. And yes, it is such a great announcement, and it's a good stepping stone. And I think you said it best there with your final remarks. It's nice to see the recognition for the people that are in the health force right now, keeping things going along for Islanders. Next, we're going to hear from Jason Woodbury. Jason is the president of the CUPE Local 3324 Paramedics Union of PEI. Jason, if you could please come forward and say a few words.
Yeah, thanks, Zach. Thank you, Premier. Thank you, Minister Hudson, and all the staff behind the scenes to make this announcement possible. I first want to acknowledge that we're gathered here on the unceded territory of the Mi'kmaq people. We have a great deal of phenomenal, skilled healthcare workers here on Prince Edward Island, including the ones that I represent, the paramedics. And over the course of the paramedic, we felt that we were being pushed in areas where we shouldn't be pushed. Told to do things that we shouldn't be doing. But we managed, and we pulled through. And we have those unique abilities to do that. I started meeting with the minister probably 3 years ago on retention, and particularly focus on retention, because we really need to keep what we have here. And we need to really work on the folks that we have here. If we can't retain what we have, then recruitment will not work. It will not work. So I was very pleased to be able to meet with the Premier, his staff, the Minister, and all my coworkers in other unions to work on this and focus on this. And we need to really put this to the employer that we need to focus on retention. So with that being said, thank you for the announcement. I think we'll work on the details on how the funds will be distributed throughout our membership with our employer and go forward. And I look forward to working in the future for more incentives to keep our healthcare workers here. We're not done. There's lots of work to be done, and this is the first step. And thank you, Premier.
Thank you, Jason. And yeah, I think the resounding words is that, it is the first step. More does need to be done. I think more will be done, but it is great to have that first step. We're now going to call on the President of the Union of Public Sector Employees here on PEI. Please welcome Karen Jackson.
Good afternoon. Premier, Minister, thank you for the invitation to attend today. And I would just like to reiterate, as president of UPSI, I've certainly been lobbying hard for recruitment and retention incentives for my members that are valuable, certainly valuable members in our healthcare system. I'm really pleased with the announcement today with the retention initiatives. I do still have some questions for the department, and the Premier and I have spoke about some of the issues that I may have with the incentive as far as being parity with our members. Anyway, that's for another day, and we will have that discussion. I'd just like to say we're very, very fortunate to have the healthcare workers we have in the system right now. They're holding our system together. They're working in very challenging work sites. And I'm hoping that this will be a welcome announcement for them. So thank you all, and looking forward to more announcements. Thank you.
Thank you, Karen. And yes, so that does conclude the formal part of today's announcement. We do thank you all for joining us online. We thank the media for showing up, as well as all of our island healthcare workers. And of course, all the people behind the scenes to make something like this announcement available today, and hopefully will be the start of future announcements. So we will be asking if any of the members of the media would like to do some interviews with the availabilities, the Premier, the Minister, or possibly some of the union leaders. We do want to thank you all for taking time out of your busy day to join us here this afternoon. Have a great afternoon. Thank you.